Andri first came to me a couple of years ago, back in 2007, when she was only 37. She had a mammogram and an ultrasound at our one-stop service here. A biopsy was taken at the same time, which gave us a tissue diagnosis that this was a breast cancer. She had what we call a wide local excision, that's a lumpectomy, and a sentinel lymph node biopsy, that is sampling some of the lymph nodes from the axilla. So we had to go back a week later to clear the lymph nodes from her axilla. Then she had further treatment with, as is often the case with many young women developing breast cancer, with chemotherapy and radiotherapy to the remainder of her left breast. She was then followed up, and as a matter of routine, we advise these patients to have annual mammography and breast ultrasound. And on the second year, which was several months ago, the mammogram identified an area of abnormality in the other breast, the contralateral breast. She had a biopsy of the area using image guidance, and this unfortunately confirmed that there was another breast cancer. That's not spread from the previous breast cancer that she had. It was a totally different histological type, and in fact it was an in situ breast cancer. That means it was at the stage 0, as we call it, is before it can possibly spread anywhere else. Then we were faced with a young woman, she was 39 at the time, going on 40, who had developed two breast cancers, two primary breast cancers, and had a family history. She was at risk of actually developing further disease, further new disease, even if we were able to cure what she had already developed. So on that basis, we discussed this with her, and she opted to go for a bilateral mastectomy and reconstruction at the same time of both of her breasts, which I think it was a very wise decision on her behalf. And she had that operation, and she underwent reconstruction, immediate reconstruction, using latissimus dorsi flaps and tissue expanders. Then several months later, and that was last summer, she had her nipples reconstructed because the nipples were removed with the operation. And now we've reached a stage where we are tattooing the color, the darker color of the nipple and areola complex. So that's where we are with Andri right now. A young woman with a family history, has had bilateral mastectomies, has developed two breast cancers. She's doing extremely well, and she's got a very good chance for cure.